Good morning, everyone. Thank you for being here. My name is Eugene D. Pasquale, Pennsylvania Auditor General, and I'm joined today by Teresa Miller, who is the Secretary of the Department of Human Services. Again, thank you for being here. Really appreciate your attention to this critical issue for Pennsylvania. 2 years ago, I stood before you roughly this time frame and told you about the 42,000 unanswered phone calls to the state's child abuse hotline that had gone unanswered in 2015 alone. By mid-2016, that number was 58,000 calls that went unanswered. That hotline, known as Childline, was suffering from major staffing and other deficiencies at the time. Thankfully, the Department of Human Services, in cooperation with the Governor's Office and the General Assembly, was able to take swift action to correct the deficiencies of the Childline and has since dramatically decreased the percentage of unanswered calls from what was roughly during our audit period of about 25%. Now we believe it is under 2%, roughly speaking. We obviously want that number to get as close to zero as possible, but that is very important progress. But once those problems were revealed, I began to worry about what was happening after these calls were forwarded to county-based children and youth offices known as CYS agencies, Children and Youth Services, or sometimes CYF, Children and Youth Families. My team spent a year reviewing how Pennsylvania's child welfare system is functioning. We talked to more than 130 people in that year, and the result was an 80-page State of the Child Special Report, which was released in September 2017. And I want to thank personally a member of my staff, Amy Gooley, who did a tremendous job in writing that report. Obviously, my entire team was involved in that process, but Amy deserves special kudos for the work she did on that. That report, The State of the Child, contains 7 observations, 5 of which dealt directly with the plight of CYS caseworkers who are really the boots-on-the-ground workers striving to keep at-risk children and their families safe. State of the Child uncovered what I had feared was true, that Pennsylvania's child welfare system is broken, and that CYS caseworkers do not have the necessary time, training, and resources to protect the children of Pennsylvania. After that report, it became clear to the vast majority of Pennsylvanians, and I was always surprised at how many people had told me that they read the report, simply because you never know how many people are actually going to see it. But that was a report that clearly a lot of average, everyday Pennsylvanians had seen. Whether they read every word of it, I don't know, but clearly a pretty big chunk of Pennsylvania had read it. So now that, and this is where Liz, my chief of staff, probably becomes the most anxious, because she knows it's never enough for me to just outline the problem. We have to find solutions. And so part of this process here today is our work after the State of the Child, which was, again, traveling all over the state, meeting the caseworkers, talking to people that were living what in many cases are the nightmare, and how we can actually better protect children. And again, I want to thank, and I'm going to go through some of those recommendations in a second, but I want to thank Teresa Miller for being here. Her department throughout this entire process has been completely cooperative. They have shared their ideas on what they can do better, what the state itself can do better, what they think the strengths and weaknesses of the laws are, and the Secretary will talk about that in a little bit after I'm done speaking. But again, I want to thank Secretary Miller and her team for their great work, and more importantly for their critical cooperation throughout this entire process. Now, for example, the Child Welfare Resource Center, which trains new caseworkers, has completely revamped its curriculum. That's one of the things that we've made some progress on. As we suggested, it now incorporates live simulations for caseworkers to practice the skills they've learned about online and in the classroom. The pilot of that new curriculum begins this summer. So that's one area where we've already seen an improvement because of our State of the Child report. We also know that the Department of Human Services has been working with the State Civil Service Commission to update the caseworker and supervisor education requirements and job descriptions, something that hadn't been done since the early 2000s. One of the issues we found in State of the Child, and without getting in too much of the mechanics of the State Civil Service Commission and the department and the counties, is that the actual job description we did not believe was tailored, and the civil service test was not tailored to what the actual job of protecting children is in today's environment. So those discussions are now taking place, and we think it's going to lead to a fruitful result, which is the actual civil service test, and the job requirements will be better suited for better protecting children. Since State of the Child was released, I've toured the state, visiting more than 20 counties on a listening tour. I've held roundtable discussions and listened to county leaders, CYS caseworkers, elected officials, private sector providers, nonprofit leaders, child abuse pediatricians, family court judges, and families affected by the system, and more. The voices of those who work with these children and families every day was clearly indispensable in putting together this report. I want to thank them and the people that supervise them and the elected officials who not only allowed that to take place, but were willing to put their neck on the line, because this is where, when I was in Washington County, again, Republican district attorney clearly said, what we're doing isn't working. We found areas where it was Democrat, Republican, it didn't matter. Everyone agreed, regardless of ideology, that the current system must get better. Now, I also, and I know sometimes one of my biggest complaints about politics is sometimes that you can't concede that you learned something new, as if you're Zeus when you first get elected to some office, and 20 years later you're not allowed to learn anything else and evolve. But I want to be clear that I have learned a lot over these last 2 years, particularly the last 7 months when it comes to child welfare. I've learned that the opioid epidemic is shattering families in a way that we have never seen before. I learned that there is a potential coming wave of a meth epidemic that could be even more catastrophic to families than opioids. I've learned that great work has been done to follow some of our recommendations from State of the Child, but in many instances, the resources are still not there to make the full necessary changes. But most of all, I learned that yes, while the system might be broken, there are so many dedicated public servants all over Pennsylvania that are fighting every single day to try to make this system better. One young man that we met in Northampton County, he was the only caseworker that was Spanish speaking. And there is a growing, in that region, Spanish speaking population. In our meeting with those caseworkers, the amount of calls and texts he got just while we were sitting there was overwhelming. And he felt the strain because, as being the only Spanish speaker on the staff, that he felt personally responsible to try to help every single one of those families. Clarion County, people with master's and bachelor's degrees that are working for the county on food stamps and still going to work every single day in some of the most challenging environments to try to help Pennsylvania's kids. That is what really gives me a lot of hope for the future, is that we have to find a way to help the people that have that core mission, but give them the tools so they can succeed. And the programs that we found are really the foundation for the State of the Child Action Plan special report that I am releasing today. The report is a 41-page action plan that offers 28 recommendations directed to 7 entities. It is the Governor and the General Assembly, the Department of Human Services, county leaders and CYS agencies, or CYF, depending on the different county, the Child Welfare Resource Center, Pennsylvania State Police, private sector providers, and the State Civil Service Commission. The action plan, if implemented in its entirety, will have an immediate impact on the amount of time CYS caseworkers can spend with at-risk children and families. That extra time and attention will, in the end, help keep those children safer. And notice I say this for a reason. I don't say safe, I say safer. There's never 100% safe, but we can make kids safer. The biggest takeaway for me from my listening tour is that the time to intervene on behalf of these children to break the cycle of abuse and neglect is right now. We simply cannot afford to wait any longer to protect children who are at risk of abuse, neglect, and death every single day. And let me be clear, we can either choose to tackle this up front, or we can pay for it on the back end with addiction, abuse, Perhaps people that, because they aren't able to get the necessary education, end up on welfare or tragically incarceration, and in some instances, even death. Here's what I do know. If the General Assembly and the governor do not invest the money now on protecting and helping children, the cost will occur. It will just be on the back end. And in terms of foster care, the juvenile justice system, and even lives, it will be exponentially higher if we don't tackle this now. And I know before I go into the specific recommendations, it's going to come in, how in God's name is the state of Pennsylvania, with a $33 billion budget, going to find the $90 million that we recommend is necessary? Cut me a break. If they want to do it, they will find it. The question is, how high of a priority is it? We're walking by on the way here. The horsemen get about $250 million a year from the state. That's $160 million more than I'm asking to invest to help better protect Pennsylvania kids. As the first recommendation points out, since 2004-2005, Pennsylvania has left nearly $140 million of federal money on the table. The state is not receiving these funds, which would help pay for foster care, because it has not updated a state law to bring it into compliance with federal law. Unfortunately, the state can likely recoup only about $3 million of that money because of time restrictions, but that's still a lot of money over the years simply to lose out on. I encourage the General Assembly and the Department of Human Services, along with the Governor's Office, to do everything necessary to garner Pennsylvania as much federal money as possible to offset the costs associated with keeping kids safe. In addition to going after more federal money, which is there, I want to be clear, that money is there. The pot of money exists. I want to highlight 5 of the 28 recommendations that stand out as potentially having the greatest impact on child welfare workers' time and therefore child safety. Clearly, the General Assembly should increase funding to provide adequate resources to proven preventative and diversionary programs that help strengthen families and prevent children from formally entering the CYS and juvenile justice systems. Many of the glimmers of hope I mentioned earlier involve such preventive and diversionary programs, and here are 2 examples of initiatives with outstanding track records. Number 1, the Nurse Family Partnership, first created by Governor Ridge in 1995. Very definition of a bipartisan program. And everyone knows, by the way, we're glad he's doing well, but former Governor Ridge, but obviously a Republican. It is an evidence-based program that helps first-time moms to transform their lives and create better futures for themselves and their babies. I visited the Nurse Family Partnership office in Bethlehem and was impressed with their success, including the fact that among the clients they serve, there was a 48% reduction in child abuse and neglect. And let me repeat that. The early intervention of the Nurse Family Partnership initiative cuts child abuse and neglect nearly in half. The line item for that program has not increased since the program was first created. That must change. On top of reducing child abuse, Nurse Family Partnership has also been proven to save money. Again, you put money into it, you're saving money on the back end. Every $1 invested in Nurse Family Partnership in Pennsylvania yields $6.70 in return to society, and $3.10 savings to state and federal governments. That is money saved down the road by keeping children out of the CYS system, out of the juvenile justice system, and out of the criminal justice system later in life. To me, that is the key. Protecting children from the beginning also reduces financial resources needed later, and perhaps even more importantly, allows more kids to pursue their dreams and to have fruitful lives. As one Nurse Family Partnership official told me, by the time CYS becomes involved, the damage to the children has already been done. In my visit to Bucks County, I learned about a successful program of youth with sexualized behavior problems. The Restoring Families program is a joint collaboration between private providers, Network of Victim Assistance, and Ravenhill Psychological Services. The program is offered at 15 sites nationwide, but the only site in Pennsylvania is in Bucks County, where the program has been piloted for the last 2.5 years. This innovative, community-based intervention program focuses on kids between 7 and 14 who have engaged in problematic sexual behavior with another child. And I know some of this discussion is uncomfortable, but the whole issue is uncomfortable, and if we're going to tackle it, we have to deal with some of the issues that make us uncomfortable. Sadly, statistics show that children acting out sexually on other children is a problem. Roughly 25% of all sexual abuse interviews at child advocacy centers nationwide involved child-on-child abuse. During the pilot in Bucks County, roughly 42% or 42 youth participated, not 42%, 42 youth participated. The average graduation rate was about 70%. Of those who graduated, 100% of families reported that it helped stop sexual behaviors. 90% of families reported the group helped their family overall, and 14 of 15 youth who were referred by CYS no longer required CYS involvement in their families. The pilot was funded in Bucks County through the Federal Office of Juvenile Justice and Delinquency Prevention, but that funding has run out. They're hoping to secure state funding in the future to keep the program working. Initiatives like these two are not only working to keep kids safe, but they can also save money and should be expanded across the state. Simply speaking, they should be in every single county, and the Nurse-Family Partnership should get a dramatic increase in funding this budget year. The second recommendation I want to highlight is for the Department of Human Services Office of Children, Youth, and Families to reduce unnecessary mandated data that must be entered for each case. In every single county I visited, caseworkers talked about the ridiculous amounts of data that they must collect and enter. Every single county, every single caseworker. We took a look at the data the federal government wants to have collected. I'm not making this up. It's 374 pages long. On top of that, there are 23 sections of Pennsylvania law that detail additional data to be collected. I think we can all agree that in 2018, some data collection is going to be necessary. But we need to have a frank discussion with the professionals across the state of what is a necessary amount that needs to be collected, but also doing a way that allows the caseworkers to do their jobs. Now, I want to say third that the Department of Human Services Office of Children, Youth, and Families should continue changes to the state-level case management system known as CWIS or CWIS. Could come up with a better acronym for that, but don't worry, I'm horrible to come up with that too, so I can't be critical there. That prevent incomplete forms from being submitted to Childline. This is one area that caseworkers told us has improved since my State of the Child report was released, and I want to commend the department for their work on that, but clearly more is going to be needed to be done, and I know the Secretary is going to, again, talk about maybe that and some other items when she comes up to talk. Fourth, county CYS agencies should improve partnerships with children advocacy centers and child abuse medical experts. I talked about children's advocacy centers for the State of the Child report as well. Simply put, these centers better help abused children, minimize the trauma that occurs when they must tell their stories, and save time and money by creating a team approach to handling each case. The final recommendation I want to highlight is that private service providers should adopt their services to address the changing needs of families. Once a family is accepted into the CYS system, private service providers deliver nearly 80% of that help they receive. These are nonprofit and for-profit companies that employ well-trained child welfare professionals who do the hard work of providing family-based therapy, running residential treatment facilities for juveniles, operating independent living services for older youth, and many of these services are court-ordered or legally mandated, and they rely significantly on public funds to complete their missions. These private providers are key partners in the system, giving families the direct help and education they need to heal and grow. Yet many of these providers are dealing with the same crushing issues as county CYS agencies, including difficulty recruiting and retaining qualified staff, heavy caseloads, and low pay. These companies must advocate for the resources they need properly to do the important social work to protect children. And before we take any questions, I want to invite Secretary Miller up to give whatever comments she would like to give about this, and then we'll be more than happy to answer any questions on our action plan of the state of the child.
Thank you. Thank you so much. I want to first thank the Auditor General for his focus on such an important issue and for allowing me to be here today. So thank you very much. I wanted to just discuss briefly how DHS is addressing some of the recommendations, a number of them identified in the report. First, though, I want to thank the staff that work in county agencies, the private providers that deliver services on behalf of counties, and the staff within the Department of Human Services who work tirelessly every day to ensure the safety and well-being of children throughout the Commonwealth. The Auditor General's report highlights the critical nature of their work and the challenges that they face every day. The report underscores the need for state and local human services systems to work collectively to support safe and healthy children and families. The recommendations validate many of the system challenges that we are working to resolve. Because child welfare is state supervised and county administered, the report recognizes that solutions must be driven by a shared commitment at all levels of government for system reform to be successful. This includes the General Assembly and local county leaders across the Commonwealth. At the department, we support many of the recommendations and are pleased to say that efforts are underway to support long-term change. I just want to take a moment to highlight some of the work that we're doing related to home visiting, Medicaid expansion, system reform, and stakeholder engagement. I'll start with home visiting, and I'm glad that the Auditor General highlighted this program. This program has earned a special place in my heart over the last few months, as I've had the privilege also to meet with home visiting providers, speak with participating families, and to learn firsthand the support that home visitors give to these families. The report calls on the General Assembly to increase funding for programs like Nurse-Family Partnership that help strengthen families and keep kids safe, so we prevent children from formally entering the child welfare system. And we couldn't agree more. The Governor has called on the General Assembly to increase funding for these programs. He's proposed $4 million to expand evidence-based home visiting programs in areas hardest hit by the opioid epidemic. This funding will serve another 800 families across Pennsylvania. He's also called on the General Assembly to provide an additional $2 million to home visiting programs so that they can enhance general capacity to serve families. By giving parents, especially those that are battling addiction, tools and assistance that they need to meet their child's needs, we hope to reduce the number of children entering out-of-home care while also supporting the parents in their treatment. In keeping with services to support individuals battling addiction, the report recommends the continuation of Medicaid expansion, an initiative that I can assure you Governor Wolf absolutely supports and is dedicated to protecting as we move forward. Upon taking office, the governor made great strides in Pennsylvania to expand access to health care to over 700,000 individuals and has significantly decreased the uninsured rate in the process to the lowest it's ever been, 5.6%. Through expansion, an additional 136,000 people have been able to access substance use treatment disorder treatment. At DHS, we remain firm that quality health care should be available to every citizen across the Commonwealth, regardless of their income or whether they lose a job. I really appreciate that the Auditor General called out the connection between Medicaid expansion and child welfare in this report, because to have healthy children, we need healthy parents to raise them. And to keep families healthy, both children and parents need to be able to access quality health care. I now want to shift just briefly to talk about the work the department is doing to address the concerns specific to the child welfare system. We know that a caseworker's top priority is ensuring that children are in a safe, healthy living environment where they can grow and thrive. We recognize the pressure and the stress that these individuals endure while fulfilling their job duties. To better support caseworkers and county children and youth agencies, we're in the process of updating county children and youth caseworker job specifications to better reflect their duties and enhance minimum education and training requirements, evaluating how we can streamline documentation requirements for caseworkers and making our software system more efficient, all issues that you heard the Auditor General mention. Ensuring caseworkers have adequate training to identify the signs of neglect and abuse before a child is in danger, while reducing the documentation burden so they can focus on helping children and families, just makes sense. The report also addresses caseload sizes and workload. We agree that one caseworker cannot adequately serve 30 families, which is the ceiling in the current regulation. We've supported counties in reducing caseload sizes so that they're manageable, and we're drafting regulations to reduce both caseworker to family ratios and caseworker to supervisor ratios. Lastly, in recognition of the shared responsibility of system reform, the department has convened work groups comprised of local county leaders and stakeholders to improve the delivery of services to children and families throughout the Commonwealth. We're committed to working with county leaders to address barriers in their system and, when appropriate, adopting statewide change. We recognize the importance of the entire system coming together and the invaluable perspective local leaders bring to the table to embrace areas where enhancements are needed to move Pennsylvania's child welfare system forward. Together, we can ensure that the policies and practices effectively foster healthy child development and prevent abuse and neglect. I want to thank the Auditor General again for all of his work on this issue and highlighting what is really a very critical issue, and for the opportunity to be here today. I look forward to the continued partnership with all the entities involved in Pennsylvania's child welfare system. Thank you.
Thank you. Thank you, Secretary. And with that, I think both of us are available for any and all questions.
It's just kind of a clarifying question. Obviously, you are the Auditor General, but now you're releasing recommendations. Just, with all respect, why is that part of what you're doing?
Well, we always release in all of our audits, we put together recommendations that fix issues that we find in previous audits. So we audit CYS offices all over the state, obviously our Childline audit, and from our State of the Child report, we found a host of issues. These recommendations are in line with fixing the problems we found.
This is actually a follow-up question, if I could. This is actually for Secretary Miller. You mentioned that you support many of the recommended changes. Are there any you don't support?
I told you that question was going to come.
We support the vast majority of the recommendations, and frankly, the few that we have concerns about, I think we're happy and will plan to continue discussing with the Auditor General and his staff as we move forward. I think this is a good blueprint to sort of look at and say, how do we continue to improve our system? And I think, as you heard, a lot of these are issues we're working on now and plan to continue working with all the stakeholders that need to be involved.
Which ones do you have concerns about?
Well, maybe the Secretary may want to follow up on. There is, I think, a legitimate philosophical discussion about what's the best way to handle the pay issue. We recommend the state picking up the entire cost. There is, I think, some concern about the mechanics. The reason why we recommend that is we heard from counties all over the state that because of the way the reimbursement works, they sometimes delay filling vacancies simply because of short-term budget crunches. So we felt if the state put up all the money up front, that would take away, because what happens is you have a vacancy, the county says, well, we're going to wait 6 months to fill it, caseworker work piles up, they get frustrated, they leave, leads to other complications. We feel by putting the money up front by the state, again, it's not in a sense additional spending on the issue, it's just where the source would come from. But I think the state, and to be blunt, has some concerns about how that would work. That's one of the issues we're trying to work through.
Is that your...
I think that's right. There's a recommendation about transferring who decides whether it's a CPS or GPS case. And today that decision is made at Childline when the call comes in. I think there's a recommendation to have that moved to the counties. Yeah. I think that's another issue that warrants further discussion about how mechanically that would even work. So there's a couple of those that, again, I think just warrant further discussion.
Yeah.
And you mentioned making the state put money up front for these vacancies. How would that not be part of the, I guess, $90 million you...
The state already spends the money, but it works as a reimbursement rate. So it's not so much whether it's new money from the state, it's when that money becomes available. So our view is if that money's up front, then the county has no reason to not fill the vacancy, because they eventually get reimbursed for that later.
And Secretary, do you have a different view on that?
I think one of the questions it just raises, if the state is taking on the entire cost of the system, I think it sort of it begs the question, do we still have a county administered system? So, I mean, we've always had a state supervised county administered system. If we're funding everything, I think it just raises the question, do we still have that system going forward?
And Secretary, do you know if Governor Wolf agrees with the, wanting to spend, $90 million that the Auditor General is recommending? Is his number different or your number?
Honestly, I have not looked at the 90 million and the breakdown. We haven't had the report long enough to necessarily go through all that, but yeah.
I would say the governor I spoke yesterday, he knows new money is part of this plan. I don't want to speak for him. He certainly is more than capable of speaking for himself, but he made it clear when we were talking about this that he knows new money is necessary to better protect children, and it's up to the General Assembly and his administration to find a way to pay for it.
And I don't, obviously you did throw out some options for getting that new money. How realistic do you think it is that the General Assembly votes for that?
Yeah, this is, I promised my team walking over that I would not go off on this answer. There's questions we all have to ask in life. How important is it? And I don't mean that to, it's an entirely fair question, because if you've seen the operation over the last 10, 15, 20 years sometimes in Pennsylvania, there are reasons to be cynical about whether the money would be found. I'm just here to tell you that if it's important, they'll find it. Period, end of story. There's ways to do it with existing revenue, new revenue, everyone in the General Assembly loves when I found that now nearly 700 million in wasted money. They all love retweeting that stuff. Now I'm putting a little heat on them to find 90 million to better protect kids. So the idea that they may feel a little pressure on this is not exactly something that's going to get me crying at night. That was my toned down version. Is that fair? Was that toned down from where I was in the hallway?
In the report you mentioned the $30 billion state budget, but how much does the state actually spend on the child protection side? The 90 million would be 90 million on top of what is the existing cost?
Are you talking, well,
State for the state.
yeah, I don't know the exact cost when you're talking about from an overall state perspective. It changes. Each county has a different spend number. From the state, you're probably talking somewhere in the neighborhood of.
I think Kathy's saying 2 billion.
Yeah, I knew it was above 1 but lower than 3, so it's about $2 billion. Yeah. Because I've found sometimes that when I say it's a number that I'm not 100% sure about, that becomes the standard for Pennsylvania. So I'm trying to become better at waiting till I know the exact answer before saying it on something like that.
And you're not specifically calling for any amount for the nurse-family partnership or any other thing, you're just saying more.
Just saying more, that's correct. And I was saying that it is not, that line item has not increased since 1995. And it was, again, instituted by a Republican governor, Republican General Assembly in 1995. And I've yet to find anyone across the state that disputes its effectiveness.
Nurse-family partnership being one thing, sorry, is something else?
Here, it doesn't. We'll get to everybody.
Quickly, one thing that's not in the report is anything about predictive analytics. I know that's been used in Allegheny County, elsewhere around the state. Your thoughts on that? Is it something that should be expanded? And I'd like to hear from you and the Secretary on that.
Yeah, we do talk about that in sort of the precursor state of the child. This is sort of like, a series of movies here, so to speak. What Allegheny County is doing on predictive analytics is, we think, top notch and should be emulated across the state. However, just a word of caution, not every county has the same technical abilities and financial resources that Allegheny County does. So I'd love to find a way that for the counties that are strapped financially or technically, for us as a state to find, I don't mean just for Secretary Miller, but for the collectively the state to find a way to help those counties. But I believe that every single county should have those type of resources and ability at their disposal.
I think from my perspective, it's really exciting to see what Allegheny County is doing. I was just out with Mark Cherna last week and seeing up close and personal kind of what they've been able to do with predictive analytics. So I think we're really interested in that. And I think from the department's perspective, are interested to try to figure out, recognizing what the Auditor General said, that not every county's in the same position technologically. Are there things we can do at the state level to try to bring some of that to the entire Commonwealth? I think we're really interested in that. I think it's a great place to be focused.
On the 90 million again, I know you mentioned nurse family partnerships. Any other specific things you want to see increases for?
Well, so one of the things I want to be clear in the report, we're not calling for additional staff at the county level. What, in a sense, the 90 million is trying to tackle is to fully fund and fully staff the positions that exist. So what we see in many counties is there may be 100 positions. Again, I'm just throwing that number out roughly, but they're only